after introducing our panelists, we're going to move on to some general questions. This is open to any of the panelists, and feel free to answer in any order. But the first question is, which fields of brain injury do you actively work in, whether it be education, research, or advocacy, and what does a day in the life look like for you?
I can start if that helps. So the field, I guess, that I'm in would be considered rehab neuropsychology. So it's a mix of rehabilitation psychology and neuropsychology. Um, you can do one or the other, and I get to do both, which is wonderful. So at an academic medical center in a medical school, my role is multifaceted, which is exciting, but can also be overwhelming at times because you're constantly switching paths. So it consists of research, training, education, and clinical work, doing my own clinical work, as well as supervising the work of trainees at different levels. So my day-to-day can consist of things like attending meetings with my own research team, attending research meetings related to other people's research that I'm a part of, meeting with mentees, trainees for supervision of their research or their clinical cases, seeing patients with them, seeing my own patients, leading didactic seminars, and then meetings with collaborators and talking through with other clinicians and researchers about other research ideas we might have. So it's an exciting sort of different roles that I get to be a part of. So yeah, I hope that answers the question.
Thank you so much. Would any of the other panelists like to answer as well?
I can go next. I think my role currently is much more clinically focused as a resident, and it does have a little bit of variety based off of kind of like what rotation I'm doing. So I'm usually either spending a lot of time in the hospital on our inpatient services, either in the ICU or on the wards. And then I will also spend some time in the clinic following patients in the outpatient setting and getting to see them kind of more long term. So it's really nice to have a mix of those. I think in the medical field in general, there are a lot of different paths that you can take. So some people spend a lot more time on research. I'm also interested in medical education, so I spend more time on that. So kind of a lot of different ways that we can spend our days.
I can go next. So as a physical therapist, just so for those of you who might not know what we do, in our role is we're rehab specialists. So we evaluate as physical therapists and treat individuals who have any mobility difficulties, injuries, and help restore function using more of a holistic approach. So I currently work in an outpatient mobile setting. So the model is we go into patients' homes and I work for a unique private setting and private company. So we provide individuals who have neurological conditions, including individuals with brain injuries, um, at least 1 hour and a half worth of a treatment session. Going to patients' homes a couple times a week, and for a longer duration of plan of care. So and I help with individuals in like more the Pittsburgh greater area. And I spend majority of my treatment sessions teaching and helping patients relearn how to do transfers, getting from a bed to the chair or getting in on and off of a toilet, bed mobility, getting in and out of the bed, being able to help restore their walking, learn how to do stairs again, within the limits of their injury at that moment, and then following from there. I also help educate family members and caregivers how to effectively help their loved ones so they also don't get hurt while caring for their loved ones. I used to work in also the hospital side where I would say 90% of my caseload was brain injury stroke cases in an inpatient rehab setting. And those are individuals who are staying in a hospital for intensive rehab services, and working closely with occupational therapy, speech therapy, and then physical medicine rehab physicians, nursing, social work, and all the interdisciplinary healthcare team more closely compared to when I'm working in like the current setting right now, an outpatient, and going into patients' homes.
And then I guess I will round us out. So for those of you who don't know, the Brain Injury Association of Maryland is a statewide nonprofit. Now you might be in different states as well. So typically hopefully there are programs like the Brain Injury Association in your state or a Brain Injury Alliance, or potentially just programs at the state level. But the Brain Injury Association is a nonprofit that specializes in information and referrals, and system navigation. So my work kind of touches every different part of the brain injury field, including community education, professional trainings, public awareness. Back in March, we were out in DC advocating to have them reauthorize the TBI bill, which provides money to states to get services out there. So also resource coordination. We do work with a waiver program in the state of Maryland as well, and then collaboration with state agencies and our community partners. Um, a day in the life, honestly, I don't know what I'm walking into every single day. It's kind of a surprise to me how my day goes. But some days I may be working directly with individuals and their families, trying to help them get connected to services to address their needs. Other days I may be partnering with our state collaboration or partners at the Behavioral Health Administration, where we go around and we train crisis intervention teams and police officers about brain injury. Or we're working on advocacy efforts, speaking with different partners about services, supporting our staff, as well as preparing for our conference, which happened 2 weeks ago. And I think we're finally in the clear here. But and then, other more leadership things as well, where I'm taking a look at programmatic needs, responding to questions from different providers, family members, and community organizations. So pretty much what my job comes down to is just connections across the board, connecting people to information, connecting people to services, connecting professionals to a better understanding, and helping connect systems that don't necessarily communicate with each other well.
Thank you so much for your answers. And now we're going to move to the second question. What common misconceptions do you encounter about brain injuries, and how can we play a better role in addressing those misconceptions? And as in the last question, anyone can feel free to start. Thank you so much.
I think I'll just zigzag back and start again, if you guys don't mind. So some misconception, oh, maybe some water would help first. Some misconceptions are that people look fine, and that means that they are back to normal. As these wonderful doctors here will be able to attest about, the physical coming back, with cognitive lacking still. And that's really where our work needs to be, because brain injury is invisible. And the amount of times that we get calls from individuals or family members saying, oh, but they said they look so good, but then why are they still having all of these problems? Um, Another misconception too is that recovery doesn't have a clear timeline. We often talk about brain injury being a roller coaster where you could come up and then there may be a backslide or a drop there, and then it throws you for a loop, and then you have to continue moving forward. It also is just there is no all of a sudden you're going to be back to normal within a couple of weeks or a couple of months. Also, don't discount anybody with a very severe brain injury either. We have had people, one of our volunteers, his daughter, 25 years after her accident, started reading again. And, they were always told that she never could. So, people are very resilient. They definitely have the power to continue to move forward. And that's what we want to do, is to be able to support them throughout the way, whether that is through medical interventions or different connections into the community.
Because my answer is so similar to Caitlin's, you don't mind, I'll go next to like echo everything that you said. Um, Brain injury isn't a one size fits all situation. Not everybody's challenges are the same. Recovery is not the same for everyone, and it can be unpredictable. So I guess the recommendation is never make assumptions about what you see and don't see. And make sure you get to know the patient's unique story and understand their individual challenges. There are some commonalities, but at the end of the day, every person has their unique mix of things that they're going through and what their life looks like, which, again, Caitlin said so well before. The different areas of their life impact them in different ways. So getting to know the whole person, the whole community that they're part of, and how that fits into, what's related to their brain injury. So, yeah.
I can go next. So I agree with both of you. Something different I could like at least add is what some misconceptions that I hear all the time from like a rehab standpoint is people who suffer from brain injuries don't get better after 6 months, 1 year, 2 years, and that's absolutely not true. I get patients coming in saying like I'm like 3 months out from my brain injury. I'm running out of time. And that's absolutely not true. People are able to recover functionally. It might be slower depending on how severe the case was, but people can improve functionally. And there's absolutely no time to give up at that point. So I always encourage and educate patients and families that continued therapy is going to be helpful and to not give up. Especially in the older adult population as well. I'm a geriatric specialist, so coming from that, of course, it might be a little bit slower compared to someone who is younger, but recovery doesn't stop after 6 months.
I completely echo everything that everybody has said already. I think brain injury can look at a lot of different ways, and people can have a lot of different experiences with it. I think one thing to keep in mind too is that what is like a devastating deficit for one person is going to be very different for another person. And so keeping in mind what's important to that patient, and what they need in their daily life to function in the ways that they want to function will be very different across patients. I think one other misconception that I will just put more broadly to any kind of neurologic disease is that a lot of people used to think of it as an area where we couldn't really do anything at all, and they just give up on things. But I think these days we still have a lot to learn about brain injury and about neurologic disease, but there's a lot more that we can do. So it's a really exciting time to also be involved in all of this.
I guess we'll move on to our third question, which is there a story or experience that changed how you think about brain injury? And again, this is open to anyone.
I think it was probably the first person that I worked with. And I wasn't even in the field yet. I was actually, much like you all, I was finishing up my first degree and I needed an internship. I had absolutely no clue what I wanted to do. I was just, pretty much getting my bachelor's in social work and had no idea what population I was interested in working with. And somebody said, well, you've been concentrating on children, like go work with another population. And so I found this internship at a hospital down here in Baltimore called the Return Program, which is a community reentry program for individuals with a brain injury. And I was working with someone who was only a year older than I was. And they were told he's never going to really be able to hold a conversation. He's not going to be able to walk independently again. He's not going to be able to live alone again. And, 15 years later, he is in his own apartment and he holds down a job and he is back to living as independently as he can. And just his journey throughout this, especially hearing those things that he can't and then being able to see all of the progress that he made while I was partnered with him We had to work on a project together. So he had to work on endurance. He had to work on his speech. So he actually had to go around and interview all of his therapy team that he was working with to get an understanding of the therapy that they provide. And then he had to present it to everybody at that program. So he had to stand up, he had to speak clearly and do all of that. And so even within the couple of months that I worked with him, that made the biggest impact. And it was the kind of thing where like I grew up with three brothers. I grew up on skates. I'm from Minnesota, so I played ice hockey, and the amount of concussions that I have is insane. Um, but you can primarily blame the brothers for that one. But I never really thought of a concussion as a brain injury. And then when I started working with my first client, I was like, oh, so this really does happen to anyone. And this really can just, knock you for a loop and change everything. And so I think that his story will always be the one that sticks with me as I continue because it was really putting a person to an injury that I had read textbooks about and that I had been researching and studying to be able to prep for this internship. And it was honestly extremely eye-opening the first go around. And I'm just so proud of how far he's been able to come and prove everyone wrong who said he can't.
I can go next. So I had a patient early on in my career when I first started working with the brain injury population. This patient, so just to backtrack, in the rehab world, we try to promote high intensity rehab training to be able to challenge their patients with their balance, their strength, anything. To be able to get them back walking, they have to be able to walk faster. We want to be able to work on those things specifically. So we want to challenge our patients. And every time I'm providing challenges with patients, I have to be mindful of like motivation level, agitation level behaviors that could interfere with our therapy sessions. And because how, depending on where the brain was affected, there's times where people may have the inability to be able to express how they're feeling. So in this case, my one patient that I worked with, every time I gave him a challenge in therapy, he would say, "This is stupid. This is stupid. This is stupid." And people would just say, "Oh, this person's not motivated," and end up kind of discharging or moving on from them and not being able to work with the individual. And when having a little bit more discussion and feeling out for what needed to, be done in this case, I had a sit down conversation and try to get as much as I can out of the individual. So the challenge was they weren't able to do something and they couldn't express any other words to come out of their, thoughts. So all they could say was, "This is stupid" at that moment. When we gave him things he was in that's more enjoyable, meaningful, he started to do more things and participate in our therapy sessions. He was able to accept challenges, and we knew if he said this is stupid, that just mean it was challenging and he's having a difficult time. So same thing with anyone who was like agitated or having like disinhibitive behavior, mood dysregulation. Instead of just backing away, we just need to work on identifying what the trigger that might be that's causing the agitation. Maybe they're incontinent, they're not able to tell us that they are incontinent, and that's the only way they can express their feelings. So I do a lot of education now with like students and even like early career clinicians who might be new to the brain injury, population. Just because someone's agitated doesn't mean that they're not motivated. They cannot be like, challenged and progressed and be able to recover.
I can go next. Um, I think one of the experiences that I had that was really impactful for me was in medical school when I was working with one of my mentors who specializes in brain injury. And he had a patient who had been in a motor vehicle accident like a little while before, was a physician, and was basically out of work because of some lingering consequences of the accident. And I think on surface level, she appeared very high functioning. She looked like she was doing really, really well. And so, like, a lot of her disability paperwork and other things kept getting denied. And my mentor had to do a lot of advocacy for her in order to get her the disability that she needed and to get her the support that she needed to kind of move forward. And so I think it was a good reminder for me that as much as we all have our own individual focuses, we really rely a lot um, on like other people in the care group, and we rely a lot on the social supports around as well. And it just reminded me that healthcare and all of these things don't really occur in a vacuum, and we have to keep all of these other pieces in mind too to help our patients move forward.
So my uh, experience was during my training. I started working with a patient that was many, many, many years post severe brain injury, um, that many are calling the chronic phase. And his wife was told by many providers that their recovery was essentially over. There's nothing else that can be done. Like, this is how it's going to be. And his wife just would not take that for an answer, and just was a fierce advocate. Which I think uh, highlights what's happening now, actually, which is a great development that Medicare is now recognizing brain injury as a chronic health condition, which can help advocate for services. I think we still have ways to go, but that is a big, big deal. That I know the brain injury associations were all a part of making happen. So thank you. It sort of made me a strong advocate for these individuals that the system has historically given up on, still probably is doing it way too much. And then also making sure that caregivers and care partners are included in care, and you collaborate with them because they're such a huge part of the person's life and their care, and also need their own support. So that case has really taught me a lot, and I still see that patient till this day and refuse to cut off services because I think there's still things we could do.
Thank you so much. I think we're going to adapt where we're just going to open it up to the audience to ask any questions. We won't be doing breakout rooms just for logistics purposes. But if anyone would like to unmute or use the chat box to ask any questions, please feel free to do so.
Hello? Hello, can you hear
Hi,
me?
yeah, we can hear you. Would you like to
I was
ask?
gonna ask, um, how is AI how is AI being used in your daily life, and how does it shape the healthcare system?
I think that's a really interesting question. Would any of the panelists like to take that one on?
I'm happy to start with this one. I think it's still so new and we're still figuring out exactly how it can be the most useful. I think a few different ways that I've seen it being used clinically so far. There's kind of like a professional version of like ChatGPT almost for medical professionals that uses literature searches from the medical literature to answer questions. So that's one way that people have been kind of playing around with using AI. to answer, I think, very specific questions and get to the data faster. And it kind of nicely like cites all of the resources that it uses, so you can go in and actually double check and verify everything that you're learning about. And then I think the other way, as like more practically as a clinician, that I've seen it start to be used is with note writing. Just because that takes up a lot of our time, I think, when we could be spending more of that time with patients. So people have started to use like AI scribes almost to try to make their workflow a little bit more efficient. So I think that's the two ways I've seen it the most.
Would any of the panelists like to also share their insights?
I think for us, it's very limited within the system itself, at least in our clinic, mostly administrative support for us as clinicians, but that's about it from a research perspective. I've used it, maybe it's gotten better before to find some things in the literature, and it did make up some references, so don't have great trust in it. Maybe it's better now. So just being mindful of that.
So much for sharing. We do have a question in the chat. Are there any great national organizations or events where students or groups can get involved in TBI support? Maybe Miss Starr, would you like to answer?
Yeah, I was just unmuting. I guess it also depends on what it is that you are looking to do. We do have opportunities from the Brain Injury Association perspective where we offer free trainings. Typically, I think it's a monthly or bi-monthly training that our new health educator is offering, just talking about brain injury. There's also the National Association of State Head Injury Administrators, and they are a phenomenal group of folks that work directly with the state leads who are in charge of the brain injury programs, and so they provide support. They bring together. They have a phenomenal conference actually, and they have one coming up here in at the end of August, and it'll be in Arkansas this year. But they have a variety of different topics and programs that they discuss. They also do have some poster panels as well. For those of you who are looking to go a little bit more into the clinical world, like doctors, there's also NABIS. It's the North American Brain Injury Society. That is a really good one where they are bringing doctors from all over the country together. And then obviously the Brain Injury Association of America as well. And so if you are taking, depending again what it is that you're interested in, if you want to email me, which I'm happy to put into the chat, I can get you connected to any of those groups as well.
I also want to mention Synapse National. One of my physicians that I worked with, she was the founder for the organization, and it's at mostly the undergraduate student level. It's across the country, and I'm happy to connect you with the organization based on where you're located as well. But they also do professional mentoring events, learning about and how to like connect with like the brain injury like population community, and also like support groups as well.
I guess another question is, Chinmayi would love to know about your thoughts on how you see industry innovation or new neurotech potentially impacting TBI care and rehabilitation. This question can be open to anyone.
I know from a community perspective, these innovations and things that they're coming up with right now can be really great. I think one of the really big barriers that we see are insurance, and whether or not insurance is willing to front the bill for something that is more, I guess maybe not FDA approved type of deal. Um, if we take a look, so here in Maryland, we have one of the best trauma centers um, in the country, and it's shock trauma. If you can get to shock trauma within an hour of your injury, you have a 98% survival rate, which is just astounding. They actually have a hyperbaric oxygen chamber trial going on right now for individuals with brain injury. But a lot of times with hyperbaric oxygen chambers, as well as any of these other more unique and new trials that are getting run, insurance really wants to see that longitudinal data and information before they make a decision. If you can get into clinic studies like that, oftentimes they are free, but there are also risks, obviously, with clinical studies as well. But it is kind of boots on the ground. And even, oh, I just put it in our newsletter that's going out tomorrow, so I probably should know this a little bit better. But there, I believe it was in Cincinnati, they came up with a mini brain to start studying concussions. So, I mean, all of these new things that are coming out are always going to be great and really good information, because, like Dr. Zong said, we truly do not know the extent of the brain and what we are capable of doing. And so everything that's coming out is just more information for us to hopefully learn and move forward with.
Yeah, I mean, there's great need for innovation in terms of getting it through the channels that it needs to go to convince, to make it one, affordable, and two, to convince insurance to pay for these things. Because there's all these potential new innovations, but to make them accessible to patients is really challenging. It has to go through a rigorous process to be FDA approved, and even then, insurance might not cover it. So there's a great need to study them, see what outcomes they have. There's a lab downstairs from us that is, working with industry partners to test some of these on people with brain injury. But it takes a lot of time and money and investment, and before it can make it to everyday clinical care. But I think it's absolutely necessary that there's more innovation to help our patients, because there just isn't enough.
Another question in the chat is, you all mentioned how brain injury not only affects the individual, but also their families and loved ones. So how can support systems address the grief of families alongside the physical healing process of the affected individual? And this can be open to anyone as well.
So in terms of how it works in my field, so almost every inpatient rehab unit should have a psychologist that's there from the beginning to support the families from injury to discharge, and then hopefully referring them to services, whether it's psychological services, social work, or whatever support groups might exist for caregivers, to process the grief, the trauma, the ongoing challenges, and just whatever might be going on and for them and the family system. So like our field is very tuned in to the needs of that and provides that care. So that's what at least we're trying to do on our end.
From the feedback that we get from family members is just being there. So many times, like, brain injury is extremely isolating, and friends are typically the first ones to go, and family is the ones that normally stick around for a while, if not forever. But it also depends on how the individual is coming back or recovering from the injury, because if they have behavioral issues, if they start becoming violent, if they start getting involved with more reckless behavior because of impulse control issues, all of that can really start to drag on the family, and they start losing themselves because they are so dedicated in the support that they give to the individual, their family member, their loved one. And just showing up, even if it is just a text here and there. They might not be able to answer right away. If you just pop by, drop off dinner and leave, like even just something, just showing that you are still there to support them no matter what, even if it's being a lending ear. One of the questions that I love to ask, and this has probably saved my marriage more than once, but is, do you need to vent or do you need solutions? Because that question opens the door for whoever it is that you're talking to, especially these families, because sometimes they just want to word vomit everything that's going on and just unburden themselves. Um, and a lot of times they have a lot of very negative feelings with, I'm not doing enough, the system's not doing enough, and then they also feel, they're failing the individual as well. And then sometimes families can even become to resent the individual as well for what it is that their dedication is taken away from them. So just showing up as best as you can, as best as you are able. Even small little things really can make a great impact.
And when I provide like family training, caregiver education, hands-on training for how to work on more like the handling skills of being able to get people out of in and out of bed, how to transfer people off and on the toilet or into the wheelchair, I always of course, I always help them, guide them if they are having trouble with anything. I always try to do any like referrals to mental health counseling, but also letting them know like thank you for showing up. And especially if the individual's not able to communicate their needs and wants and appreciation, I always like remind the family members and caregivers like thank you for showing up, and I'm sure the individual who their loved one will be very appreciative that you are here and helping them out, and you are the biggest support. So showing appreciation to the family caregivers is always important from like a therapy standpoint as well.
I totally agree with what everybody else has said. I think in my field, we are maybe not as good about this as we should be, and it's something that people are more interested in now. But I think one thing that I've noticed that's also really helpful for some of our family members is on the flip side, being involved in like the support groups and the national organizations and being able to connect with other people who are going through the same thing. Because, like everybody else was saying, a lot of people in their community don't necessarily understand what they're going through. And so being able to have those other people that they can talk to and connect with is really helpful for them.
Thank you so much for sharing. Our next question in the chat is, how can students or young people contribute to raising awareness or supporting patients?
Honestly, doing what you're doing right now, and having these conversations with people. Uh, like I said earlier, I never thought concussion was a brain injury, and concussions can change your life. Um, the amount of folks that I've worked with, and then also, well, gosh, okay, you can clearly tell I'm starting to get tired here, but um, I feel like so many things are downplayed. Because if you take a look at these Hollywood movies, I mean, growing up, my favorite movie, Home Alone in New York, Home Alone 2, Marv had so many brain injuries, but yet he was so okay in that movie, and that's not how it happens. I feel like when we are taking a look at this stuff, and people are coming out of comas in these shows, and oh my gosh, I could tell you everything that happened. That's just not real. And so those types of misconceptions of, oh, they're going to be fine, oh, something's going to happen, can also cause problems. But really, it's educating people, talking about this. If you yourself have had a brain injury, talk about it. It's truly where the impact is not hiding this, is not being the best kept secret. We don't want that. We want more people to know about it, because there are probably so many people walking around with an undiagnosed brain injury that we don't even know. The amount of people that have had brain injuries it's estimated, and we know that the CDC is behind in collecting data and information, but it is estimated that it's 2.8 million. And that's only for people that go to the emergency room or get hospitalized. That does not include urgent cares, your primary care physician, anything along those lines. CDC does not collect that data. And so we probably have a lot more, like a significant amount of people that have brain injuries. And then if we take a look at the opioid epidemic right now too, with people overdosing and the use of Narcan, which is phenomenal, and we love the fact that it's bringing people back and that it's saving their lives, but it's also potentially causing anoxic and hypoxic brain injuries. And so these really aren't being discussed. If you can answer the three questions that the paramedics ask you after they hit you with the Narcan, what year is it? Who's the president? Where are you? They release you. And so we don't know with how many people are actually walking around with a brain injury. And I think I'm probably going to be done talking for the night. I am talking around in circles now, so I will turn it back over to the other ladies.
Would anyone else like to tackle on the question? And if not, we can also move on to another question. I guess for time's sake, this will probably be our last question. But for students pursuing medical school, what are the different avenues in med school or residency to specialize in brain injury? And what should these students be looking for in a medical school if they want to pursue brain injury care?
That's a really great question. I think there's a lot of different ways that you can pursue a specialty in brain injury, which is really nice, just kind of depending on what your interests are, and what you want your day-to-day career to look like. I would say the three main specialties that you would be involved in brain injury with are neurology, physical medicine and rehabilitation. So the rehabilitation specialists, and then the neurosurgeons as well. And we're all kind of involved at different stages of the brain injury and kind of focus on different aspects of brain injury. So I think those would be kind of like the three to look into and decide among them which aspects you're more interested in, what you want to focus more on. And then as far as looking for something specific in a medical school, I I think I would say any medical school honestly will prepare you, and you kind of want to get that basic medical training first and make sure you have a good understanding of just medicine in general before you are specializing. But if you are specifically interested in brain injury, I think if you're somebody who's interested more in the rehabilitation aspect, you might want to try to look for somewhere that has a stronger affiliation with a rehab hospital or has a really strong rehab type of program where you'll get more exposure to that. I think that's one of the areas where people get the least exposure and don't realize that it's a field that they can go into until it's later on in medical school and they've already applied. And then if you're interested on the flip side in more of the acute care setting, or you kind of want to do more of the neurology, neurosurgery side of things, then going somewhere where they have a strong department in that area so that you can get that exposure again to these fields.
Would anyone else like to answer the question as well?
I can't speak for medical school because I'm not a physician. I'm a physical therapist or doctor, clinical doctorates, but from my standpoint, there's no specialization for brain injury specifically in the rehab world in physical therapy or occupational therapy. But at least in physical therapy, we can go through certifications to learn more and get more knowledge about brain injuries. And also, there's a neuro specialization specifically for individuals who are interested in the neurological conditions and treating these individuals, in doing a residency or just working on their board specialization.
Since we're almost out of time, I think this will conclude our panel event, but I'll pass it over to Chinmayi to give us some final remarks, and then we'll say some other final words of how you can stay connected with Simply Neuroscience.
Thank you, Danielle and Maria. Wonderful job hosting, and thank you again to all of our panelists for your time on a Thursday evening. Just wanted to thank everyone as well for your interest and questions. I think it's just truly incredible to see how many people are passionate about learning more about TBIs and brain injury, especially this early in our careers. I know many of us here are high school, college students, or perhaps grad school. So definitely encourage everyone to continue to follow up with the resources that were shared in the chat and mentioned earlier as well. And we'll, of course, be continuing to amplify a lot of information and resources related to TBI through our awareness team. So always definitely keep an eye out on our social media and newsletter as well to stay in touch. Thank you, guys.
A huge thank you to our panelists and attendees. We hope you enjoyed today's panel event, and if you would like to stay connected with Simply Neuroscience, we encourage you to sign up for our newsletter with the link in the chat or by scanning the QR code, so I'll send that right now. The second link is also to our feedback form, so we kindly ask that you fill it out so we can continue to improve these events for future guest speaker events. But thank you so much, and we truly appreciate you taking the time, especially for the panelists. Thank you so much. We really appreciate you taking the time out of your busy schedule to help us out with this brain injury awareness panel event.
Thanks, everyone. Have a great night.
Good night.